Hi everyone, this is Dr. Drew Tortoriello here from Sher Fertility Solutions. I'm taking an opportunity this morning to introduce a new series of webcasts that we are going to do that focuses on us addressing some of the more common questions that patients have for us. Today we're going to talk a little bit about egg reserve and how do we assess egg reserve in the patients that come to see us. Egg reserve is predominantly assessed by hormonal blood values. Ideally, the patient will come to see us on day 2 or day 3 or day 4 of her menstrual cycle, and we will look at 3 key hormones. One is her FSH hormone, one is her estradiol hormone, and one is the AMH hormone. In a woman's menstrual cycle, the FSH hormone is the signal that comes from her pituitary gland down to the ovaries to get the ovaries to sort of wake up a little bit and recruit a follicle or two to mature over the course of the next 2 weeks and ovulate. And in general, the better the egg reserve a woman has, the less FSH is required to get the job done. So if you see FSH values that are exceeding 10 on day 2 or day 3 in that window, it's a little bit concerning that she may have some diminished egg reserve. The second hormone that we look at is estradiol. Estradiol is a product of the growing granulosa cells within the follicles in the ovaries. We find that as women get a little bit older, they tend to recruit follicles a little bit more quickly. And when they recruit follicles a little bit more quickly, they are more inclined to have higher than normal estrogen levels early in the cycle. So if you see an estrogen value that's greater than 70 picograms per ml or thereabouts early in the cycle as well, you might be a little bit concerned. The newest version of the hormonal assessment testing that we do is the AMH hormone. And AMH is also a hormone which is a product of the granulosa cells in the follicles. And there's somewhat of a linear correlation between the number of granulosa cells, the number of follicles that a woman has, and the AMH value. So if the AMH value is very, very low, you'd be concerned that the follicle count also is very, very low, and the egg reserve is going to be very, very low. AMH, I find, is probably the most helpful when it is in the extremes, meaning that if it's very, very low, you're concerned about egg reserve being very, very diminished. If it's very, very high, you're concerned about the potential for the woman to overproduce eggs and hence face a risk potentially of hyperstimulation or bloating when she undergoes her treatment. When it's in the middle, there's a very significant degree of overlap, and you can potentially get a very differing number of follicles and eggs from women that can have the same AMH value when it's somewhat in the middle of the range. The last thing that I want to speak about is the follicle count itself. It is a sonographic assessment, numerical counting really, of the follicles that we see on both ovaries. And initially we didn't really place a tremendous amount of emphasis on this because we know that sometimes follicles come and go very quickly, and you can have follicles that appear to be present on any given day and then potentially a week later there may be less. So because it's such an ephemeral thing, we didn't really put a lot of emphasis on it. But studies in time has proven that the follicle count that you see on any given day in a woman is actually a fairly good and reliable indicator about her egg reserve. And sometimes some doctors even find that it supplants the hormonal assessment when you're going for that specific month that you want to do treatment. For example, an FSH value might be a little bit elevated on day 2 or day 3 in any given month, but if in that same month her follicle count is reassuring, if there's 7, 8, 9, 10, 12 follicles, that is potentially a good month for proceeding with treatment. But overall, the number is a helpful guide towards understanding the gestalt of the ovarian reserve. I hope this has shed a little bit of light on the egg reserve question. We will be following up with several more questions being answered in this particular format. And if there are questions that are of interest to you, you can access the Ask a Doctor a Question feature of our website at sherfertilitysolutions.com. Thank you so much.